For those who've not heard of it before, the direct primary care is a model for primary care in which physician practices charge patients a fixed periodic fee, usually a monthly fee, for a suite of primary care services. Services include patient exams, routine labs, x-rays, consulting services, sick care, health maintenance, wellness service, chronic disease management, minor procedures such as stitches, wart removal, rapid stress tests, really a electrocardiogram, quite an array of procedures can be included in this. Some practices include immunizations and nutrition services as well. Importantly, DPC practices do not bill third parties. They don't bill insurance companies. They don't bill government programs. And by moving away from fee-for-service insurance billing, what they find is that they can leave behind the overhead costs associated with third-party billing. And then with that less overhead to pay for, they can sort of redeploy that efficiency in terms of things like longer visits, 24/7 access, and offering that to their patients, and other benefits. On the patient side, to protect against the unusual, unexpected, and catastrophic medical needs, almost all DPC patients purchase a high deductible wraparound insurance policy if you go the route of DPC, and it's a perfect complement for that. This is a table of various estimates of that monthly fee that I was referring to, as reported in the literature. The average direct primary care subscription fee is about $75 per month. There is a range there, but that corresponds to different levels of services, and there may be more or less for a given practice. How long has direct primary care been around? Well, in one sense, it's sort of the original model of care. But if you're talking about the term DPC and the more recent reemergence of it, it's been probably about the last 10 years or so. Again, this is a table from the report. It shows various estimates of the number of DPC practices nationwide over time. Back in 2014, there were an estimated 125 DPC practices nationwide. And today, there are about 1,700 practices nationwide. So that's 1,700 practices out of something like 230,000 total medical practices in the United States. A small percentage. And I think this will continue to grow, but I think it'll continue to grow relatively slowly unless we can add another piece. And that's kind of what I'm building up to here.